Hello, everyone. Happy Tuesday. How are you today? I am going to give everyone a few seconds to get in. Hello, blessings. How are you? Give everybody a few seconds to join, and then I'll go ahead and get started. All right. Let's see. All right, I'm going to go ahead and get started. My name is Phyllis, and welcome to Florida Training. Today, we will be talking about what is walking pneumonia. You're going to learn symptoms, care tips, and we're going to test your knowledge with real life scenarios for CNA and nursing students. All right, if you're just not joining, welcome. All right, let's go ahead and get started. Hi. Hello. All right, let's go ahead and get started. What is walking pneumonia? All right, definition. A milder form of pneumonia, also known as atypical pneumonia, caused by bacteria, most commonly Mycoplasma pneumoniae. Patients are often able to continue daily activity, hence the term walking pneumonia. Key points. Less severe than typical pneumonia, but still requires medical attention. Commonly affects children, elderly, and those with weakened immune systems. Hello, if you're just not joining, we are talking about what is walking pneumonia. We're going to start off with a presentation, then we're going to do a short quiz at the end. Common symptoms of walking pneumonia is persist dry cough, often lasts several weeks, low-grade fever, fatigue, and general Malaysia, sore throat and headache, mild chest pain, or shortness of breath. Differences from typical pneumonia, milder symptoms. Patients can generally perform daily activities, no need for hospitalization in most cases. Physical examination. Listening to the lungs for abnormal sounds such as crackles or wheezing. Diagnostic tests. Chest x rays may show mild lung inflammation. Blood tests to check for infection markers. Sputum culture to identify the causative organism. I'm sorry. I can't talk today for some reason. Tongue twisted Tuesday. All right, antibiotics. Often prescribed if caused by Mycoplasma pneumoniae. Symptomatic treatment, over-the-counter medications for fever, sore throat, and cough, hydration, and rest. When to seek further care. If symptoms worsen, such as high fever or difficult breathing, if not responding to treatment within a few days. Hydration. Encourage patients to drink plenty of fluids to thin mucus and stay hydrated. Rest. Getting adequate rest even if the patient feels well enough to be active. Avoiding irritants. Avoid smoking or secondhand smoke. Using a humidifier to keep air moist and easier to breathe. Good hygiene practices. Frequent hand washing, covering mouth and nose when coughing or sneezing, using tissues or coughing into the elbow to prevent the spread of droplets. Vaccination. While there is no specific vaccine for walking pneumonia, flu vaccination can help prevent viral forms of pneumonia. Avoiding contact with infected individuals, especially important in schools, dorms, or workplaces. Recognizing symptoms early. Teach patients to recognize mild but persistent symptoms like a dry cough or fatigue. When to seek medical advice. If symptoms worsen or persist after several days, they should contact their healthcare provider. Completing antibiotic treatment. Patients should complete the full course of antibiotics even if they feel better to prevent antibiotic resistance or reoccurrence. All right, you guys, I'm going to give you a few seconds and we are going to do the quiz. We are going to do the quiz. All right, change up a little bit. Now you can see me. Hey, everybody. All right, let's go ahead and get started with the quiz. Oh, okay. Well, good. I pray that you could pass it. I think you're going to do good. All right, let's go ahead and get started. What is another term for walking pneumonia? Is it A, typical pneumonia, B, bacterial pneumonia, C, atypical pneumonia, or D, viral pneumonia? Drop your answers in the chat box and let me know what you think it is. A, B, C, or D? Is it A, B, C, or D? What is another term for walking pneumonia? Okay, we got two. All right, you guys, go ahead and give it a try. A, B, C, or D? All right, let's go ahead and review the answer. If you chose answer C, you are absolutely correct. Atypical pneumonia. Walking pneumonia is often referred to as atypical pneumonia due to its milder symptoms compared to typical bacterial pneumonia. All right, what is the most common cause of walking pneumonia? Is it A, Streptococcus pneumoniae, Mycoplasma pneumoniae, influenza, Staphylococcus aureus? A, B, C, or D? What is the most common cause of walking pneumonia? Drop your answers in the chat box for me. What do we have? Answers in the chat box. Okay. Let's get those answers in. All right, let's go ahead and review the answer. Oh, I got some more coming in. All right, let's go ahead and review the answer. If you chose B, you're absolutely correct. Mycoplasma pneumoniae. Mycoplasma pneumoniae is the most common bacterial cause of walking pneumonia, particularly in younger individuals. All right. Walking pneumonia typically spreads through which method? A, contaminated food. B, respiratory droplets. C, blood to blood contact. D, insect bite. Walking pneumonia typically spreads through what method? A, B, C, or D? Give you a few seconds to drop your answers in the chat box. Go ahead and drop your answers in the chat box for me. All right. If you are just not joining, we are talking about what is walking pneumonia. All right. Let's go ahead and review the answer. If you chose answer B, you are absolutely correct. Respiratory droplets. Walking pneumonia is spread through respiratory droplets when an infected person coughs or sneezes. All right. Which of the following is a key symptom of walking pneumonia? Is it A, high fever, B, productive cough, C, dry, persistent cough, or D, severe chest pain? Which of the following is a key symptom of walking pneumonia? A, B, C, or D? What do we have? Drop your answers in the chat box. And once again, if you are just now joining, my name is Phyllis. And today we are talking about what is walking pneumonia for CNAs and nursing students. All right, let's go ahead and review the answer. If you chose answer C, you are absolutely correct. Dry, persistent cough. Walking pneumonia typically presents with a dry, persistent cough, unlike typical pneumonia, which may produce phlegm. All right. What is most at risk for walking pneumonia? Who is most at risk for walking pneumonia? Is it A, elderly individuals, B, people with heart disease, C, young children and the elderly, or D, newborns? Who is most at risk for walking pneumonia? Do you think it's A, the elderly, B, people with heart disease, C, young children and the elderly, or D, newborn babies? Who is most at risk for catching walking pneumonia? Go ahead and drop those answers in the chat box for me. All right. All right, we'll go ahead and reveal the answer. If you chose answer C, you are absolutely correct. Young adults and children. Walking pneumonia is common among young children, older adults, and those with weakened immune systems. Way to go, you guys. What diagnostic tool is most commonly used to confirm walking pneumonia? Is it A, MRI, B, CT scan, C, chest x-rays, D, lung biopsy? What diagnostic tool is most commonly used to confirm walking pneumonia? Is it A, MRI, B, CT scan, C, chest x-ray, or D, lung biopsy? Drop your answers in the chat. Let me know what you think it is. Okay. See, my answers are rolling in and rolling and rolling in. All right, ladies and gents, let's go ahead and review the answer. If you chose C, you are absolutely correct. Chest x-ray. A chest x-ray is typically used to detect mild lung inflammation in cases of walking pneumonia. CCC is the correct answer. Oh, true or false question. Walking pneumonia is generally considered more severe than typical pneumonia. Is it A, true, B, false? Drop your answers in the chat and let me know what you think it is. Is it true or is it false? Walking pneumonia is generally considered more severe than typical pneumonia. If you are just now joining me, we are talking about what is walking pneumonia. Drop your answers in the chat for me. A or B? A or B? Drop that A or drop that B in the chat box to let me know what you think it is. Okay, got some true, got some false. Anybody else going to drop your answer in the chat box? All right, I'm going to go ahead and review the answer. If you chose B, you are absolutely correct. It is false. Walking pneumonia is a milder form of pneumonia, often allowing individuals to continue their daily activities. So if you chose B, you are absolutely correct. Next question. Which of the following lifestyle modifications can help manage walking pneumonia? Is it A, increasing physical activity, B, increasing sugar intake, C, avoiding all medications, D, staying hydrated and resting? Which of the following lifestyle modifications can help manage walking pneumonia? Is it A, B, C, or D? Drop your answers in the chat box and let me know what you think it is. So, which one can help manage walking pneumonia? Lifestyle modifications can help manage walking pneumonia. Hello. All right, get those answers in that chat for me. All right, we're going to go ahead and reveal the answer. If you chose answer D, you are absolutely correct. Staying hydrated and resting. Adequate hydration and rest are key components of managing walking pneumonia and speeding up recovery. So remember, walking pneumonia, you stay hydrated and well rested. It's a speedy recovery. All right, next question. What type of medication is often prescribed to treat walking pneumonia caused by bacteria? Is it A, anti-pneumonials, B, antivirals, C, antibiotics, D, steroids? Is it A, B, C, or D? What type of medication is often prescribed to treat walking pneumonia caused by bacteria? A, B, or C? Drop those letters in the chat box and let me know what you think it is. Let's see. All right, let's go ahead and reveal the answer. If you chose C, antibiotics, you are absolutely correct. Antibiotics are typically prescribed for walking pneumonia caused by Mycoplasma pneumoniae. That's a cute, like a pneumonia. like I never heard it spelled that way. Well, I'm sorry, pronounced that way. Pneumonia. All right. What should a patient with walking pneumonia seek further medical care? When should a patient with walking pneumonia seek further medical care? Is it A, if symptoms improve quickly, B, if symptoms worsen or persist, C, if they feel better after a few days, D, if they start coughing? When should a patient with walking pneumonia seek further medical care? Is it A, B, C, or D? Drop your answers to the chat box and let me know what you think it is. A, B, C, or D? All right. Let's go ahead and review the answer. If you chose answer B, you are absolutely correct. If symptoms worsen or persist, if symptoms get worse or don't improve after a few days of treatment, the patient should seek additional medical care. So if you don't feel better after a couple of days, back to the doctor you go. What is one way to prevent the spread of walking pneumonia? Is it A, avoid contact with pets? B, use a humidifier? C, frequent hand washing? D, increasing fluid intake? What is one way to prevent the spread of walking pneumonia? Is it A, B, C, or D? Drop those answers in the chat box and let me know what you think it is. All right. See what we got going on. Okay, drop them, drop them, drop them, drop them. All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Frequent hand washing. Good hygiene practices like frequent hand washing can prevent the spread of respiratory infections like walking pneumonia. Way to go, you guys. All right. Which of the following is not a common symptom of walking pneumonia? Is it A, sore throat, B, fatigue, C, high fever over 104, D, headache? Which of the following is not a common symptom of walking pneumonia? A, B, C, or D? Drop one of those alphabets in the chat and let me know what you think it is. And remember, you guys, if you ever need to go back, you can always go back onto the YouTube channel, or you can always go to www.floridatraining.com. All right, let's go ahead and review the answer. If you chose C, you are absolutely correct. High fever over 104. Walking pneumonia typically causes mild fever, not high-grade fever like in more severe forms of pneumonia. All right. Walking pneumonia primarily affects which system in the body? Is it A, digestive system, B, respiratory system, C, circulatory system, D, nervous system? Walking pneumonia primarily affects which system in the body? A, B, C, or D? Okay, we got them rolling, rolling, rolling. All right. All right, let's go ahead and reveal the answer. If you chose B, the respiratory system, you are absolutely correct. Walking pneumonia affects the lungs and respiratory system, causing coughing and other breathing difficulties. A patient with walking pneumonia should increase fluid intake to A, keep the airways moist and thin mucus, B, increase blood pressure, C, increase body temperature, D, avoid weight gain. A patient with walking pneumonia should increase fluid intake to A, B, C, or D. Let me know what you think it is. Drop those letters in the chat box. Drop those letters in the chat box. Let's go ahead and review the answer. If you chose A, you are absolutely correct. Keep the airways moist and thin mucus. Drinking plenty of fluids helps thin mucus and keeps airways moist, making breathing easier. All right. What is a typical duration for the recovery of walking pneumonia with antibiotics? Is it A, 1 to 2 days, B, 1 to 2 weeks, C, 3 to 4 days, D, 6 to 8 months? What is a typical duration for the recovery of walking pneumonia with antibiotics? Is it A, B, C, or D? Which one do you think it is? Drop your answers in the chat box and let me know. All right, they drop it. All right, let's go ahead and review the answer. If you chose B, you are absolutely correct. 1 to 2 weeks. Walking pneumonia typically revolves within 1 to 2 weeks with antibiotics, although the cough may persist for a long period. What is the first step in managing a patient suspected of having walking pneumonia? Is it A, performing a blood transfusion, B, assessing their oxygen level, C, ordering an MRI, D, performing a surgical procedure? What is the first step in managing a patient suspected of having walking pneumonia? A, B, C, or D? What do you guys think it is? Drop your answers in the chat and let me know. And let's see what we got. All right, my ladies and gentlemen, let's go ahead and review the answer. Oh, they're still coming in. Okay. All right, let's go ahead and review the answer. If you chose B, you are absolutely correct. Assessing their oxygen level. Checking vital signs, including oxygen level, is crucial in assessing the severity of pneumonia and ensuring proper respiratory function. Way to go, guys. Walking pneumonia is commonly diagnosed in A. School age children, B. Healthy young adults, C. Adults aged 25 to 45, D. Individuals with asthma only. Walking pneumonia is commonly diagnosed in A, B, C, or D. Drop those answers in the chat. Drop those answers in the chat and let me know what you think. A, B, C, or D. If you are just now joining and you are coming in the middle of the quiz, don't forget you can always go to www.floridatrainer.com and review this video again. All right, let's go ahead and review the answer. If you chose A, you are absolutely correct. School age children. Walking pneumonia often affects those ages 5 to 15 years old. It is often brought home by young children who get it at school and then affect family members. Which of the following is not a way walking pneumonia can be transmitted? Is it A, coughing, B, sneezing, C, touching contaminated surfaces, D, drinking contaminated water? Which of the following is not a way walking pneumonia can be transmitted? Is it A, B, C, or D? All right, drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's go ahead and review that answer. If you chose D, you are absolutely correct. Drinking contaminated water. Walking pneumonia is primarily spread through respiratory droplets, not through contaminated water. Way to go, you guys. A patient with walking pneumonia has a new onset of confusion. What should the CNA do first? A. Leave the patient and notify the nurse at the end of rounds. B. Reassure the patient and offer water. C. Report the change in mental status to the nurse immediately. D. Document the patient confusion and continue with the next task. A patient with walking pneumonia has a new onset confusion. What should the CNA do first? A, B, C, or D? Drop those letters in that chat and let me know what you think it is. All right, let's go ahead and review the answer. If you chose answer C, you are absolutely correct. Report the change in mental status to the nurse immediately. A sudden change in mental status like confusion can indicate worsening of the patient's condition or complications. The CNA should promptly inform the nurse for further assessment. Delaying this communication could lead to missed signs of clinical deterioration. What is a common complication of untreated walking pneumonia? Is it A, sepsis, B, heart attack, C, respiratory failure, D, liver failure? What is a common complication of untreated walking pneumonia? A, B, C, or D? Drop those letters in the chat and let me know what you think it is. All right, let's go ahead and review the answer. If you chose C, you are absolutely correct. Respiratory failure. If untreated walking pneumonia can worsen and lead to more severe respiratory issues such as respiratory failure. Told you today is tongue twister Tuesday for me. So, if untreated, walking pneumonia can worsen and lead to more severe respiratory issues such as respiratory failure. Which of the following is part of the treatment for walking pneumonia? Is it A, strict bed rest for 6 months, B, over the counter cough suppressants, C, surgery to remove fluid, D, blood transfusion? Which of the following is part of the treatment for walking pneumonia? A, B, C, or D? Drop those answers in the chat and let me know what you think it is. All right. Got some B's, C's. All right, let's go ahead and review the answer and see what it is. If you chose B, you are absolutely correct. Over-the-counter cough suppressants. Over, over-the-counter medications such as cough suppressants can help alleviate symptoms of walking pneumonia. Why should patients with walking pneumonia avoid smoking? Is it A, it increases fluid retention, B, it suppresses hunger, C, it irritates the lungs and worsens symptoms, D, it lowers body temperature? Why should patients with walking pneumonia avoid smoking? A, B, C, or D? What do you guys think it is? A, B, C, or D? Okay, got a lot of C's, got a lot of C's, a lot of C's, a lot of C's. All right, let's go ahead and review the answer. If you chose C, you are absolutely correct. It irritates the lungs and worsens symptoms. Smoking can further irritate the lungs, worsening the symptoms of walking pneumonia and slowing recovery. A patient with walking pneumonia is most likely to be treated A, in intensive care unit ICU, B, at home with rest and antibiotics, C, with surgical intervention, D, with chemotherapy. A patient with walking pneumonia is most likely to be treated A, B, C, or D. Drop those answers in the chat and let me know what you think it is. All right, I see a lot of B's. I see a lot of B's. Okay, let's go ahead and review the answer and see what we got. If you chose B, you're absolutely correct. At home with the rest and antibiotics. Walking pneumonia is mild enough to be managed at home with rest and fluids and antibiotics. Which of the following is a lifestyle recommendation for patients recovering from walking pneumonia? A, increase salt intake. B, engage in high intensity exercise. C, use a humidifier to ease breathing. D, sleep in a cold or dry room. Which of the following is a lifestyle recommendation for patients recovering from walking pneumonia? All right, let's see some C's, B, C's. All right, let's see C's, C's. All right, let's go ahead and review the answer and see what we got. If you chose C, you are absolutely correct. Use a humidifier to ease breathing. A humidifier adds moisture to the air, helping to ease breathing and reduce irritation in the lungs. What advice should be given to a patient taking antibiotics for walking pneumonia? Is it A, stop taking the antibiotics when you feel better? B, only take antibiotics if you have a fever? C, complete the full course of antibiotics? D, share the antibiotics with family members? What advice should be given to a patient taking antibiotics for walking pneumonia? A, B, C, or D? Drop those answers in the chat, you guys. Drop them in the chat. Drop. All right. I see a lot of C's. Let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Complete the full course of antibiotics. Patients should always complete the full course of antibiotics, even if they feel better, to prevent the infection from returning and to avoid antibiotic resistance. Way to go, guys. All right, you guys, thank you for watching. We have come to the end of the road for today. Please comment, like, share, and subscribe. You can always catch us at www.floridatraining.com. Anybody want to drop in the chat what the next session should be? We can try to get something prepared. I'll be back on next week. So please make sure that you look out for that information. Anybody have anything that they would like to review or go over? Let me get you guys the email if you have any further question. Oh, you are more than welcome. More CNA questions? Okay. But more CNA questions like what? Let me see. More CNA questions like what? Let me see if I can. I don't think I. You're welcome. You're welcome. So please don't forget to comment, like, share. Happy Tuesday, everyone. I will not be back on until next week. So you guys enjoy the rest of your week. Have a wonderful and safe weekend. Good night.